Well, I just wanted to talk about my experience of having the implants done. Um, what the need was that I had severe periodontal disease and I had significant bone loss. And when I came to see Dr. Tatch for the first CT scans and sat down with him, I was amazed at what the true picture was. It was more severe than I had ever imagined. Um, so he made the recommendation that I have the implants based on the fact that I have a very strong gag reflex. And he and my dentist, Dr. Basauskas, felt that I would probably not be a good candidate to have a regular denture because the gag reflexes were so strong. So I went with their recommendation and came in and had the remaining teeth removed. I had actually sustained some not only bone loss but actually teeth loss. And so I came in and I had the additional remaining teeth removed on the same day that the implants were made. And the team did an excellent job from the very get-go of the process. I was sedated under light sedation here as an outpatient and actually didn't experience pain because of the light sedation. There was very little pain even after I went home, and I was advised to take the 3 Advil for pain and as an anti-inflammatory. There was some swelling on the second day after the procedure, but I used the ice packs as advised, and by having had the procedure on Wednesday, I used ice packs on Friday, and by Saturday when I had a family gathering that I attended, no one could even tell that I had had any procedures done. So I found that quite remarkable that the swelling had all gone down by that time. It has been a very positive experience. I never had very good looking teeth throughout my life, but I feel like that with the prosthesis that the technicians made, that I have a very attractive set of teeth and I've adjusted to them well. I'm very thankful that with the great experience of Dr. Tatch and Dr. Belzanska and the technicians that the outcome has been so positive. Before the day of the actual procedure, my husband and I did have the opportunity at Dr. Tatch's request for him to explain the entire process that I was facing. And he was very thorough with his information, offered us the opportunity to ask any questions or express any concerns that we had. I can remember vividly that day because it is a procedure that you don't take lightly. But Dr. Tatch was very thorough with his information. On the day of the procedure, we came in, the team was ready for us, the team of Dr. Tatch and his nurse, my dentist, and the technician. They were very thorough, making sure that I was comfortable both emotionally and physically. We left here, went home. I rested most of the afternoon, though I was in no pain. It was an emotional experience that required me to rest a little bit in the afternoon. But later in the day, into the evening, Dr. Tatch personally called to ask if I had any questions. He was checking up on my well-being, making sure that everything was as it should be. So his post-care was just absolutely what it should be. And I was very comfortable speaking with him. He just put me at ease at every turn. Following the procedure and the permanent placement of the permanent prosthesis, I could eat just anything that I want to. My ability to eat apples or a steak or anything like that are in no way restricted now with the prosthesis that's permanently implanted. I am very happy that I do not have the facing the process of having to take out a denture every night and putting it back in, both from the comfort level and just from the appearance. The permanently implanted prosthesis gives me structural support in my face, leading to, I think, a good physical appearance. There was little adjustment needed as far as my speech.